Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. If you're suffering from neuropathy, or if you know someone that's suffering from neuropathy, you're definitely going to want to stay tuned. We have some exciting announcements. We're going to be launching a new treatment option for patients that are suffering from neuropathy that's covered by insurance. You're not going to want to miss this one, so stay tuned. Okay, Dr. Mike, neuropathy. We've talked about this a few times. This is a very complicated condition. And folks, for those of you that are watching that aren't familiar with the pain and the symptoms associated with neuropathy, it's quite debilitating, and current treatment options are limited. They're only focused around getting, symptom relief. And the problem with that is the medications that are involved can oftentimes lead to more problems, and they're not really addressing the problem with the neuropathy. The neuropathy continues to get worse. We've been searching high and low for an evidence-based treatment protocol, and we found one, and we're excited to announce we're going to be launching this soon in our clinic. And the best part about it, a lot of patients are going to have access to this treatment option because it's covered by insurance.
Yeah, as you mentioned, the complexity of a neuropathy, as we just make it simple, is pathology in the nerve, or the nerve is damaged peripherally, and most commonly in the lower extremities. So people who have pain or symptoms are usually felt in the feet. Well, if we think about the multiple reasons or causes of neuropathy, what's nice about this new system is you can take all comers, so to speak. It doesn't matter what may have caused or led to this diagnosis of neuropathy, but it really is a way that we can diagnose it and give some treatment. Again, there's definitely some element of treating the symptom to decrease pain, decrease funny feelings, but it's also potentially showing, again, insight to aspects of improving the vascular supply to the nerves, the lower extremity activity and functional improvements, so we really can capitalize on the benefits of this new treatment.
Yeah, and what's exciting too is we're seeing some great pre and post studies that are available. They use a punch biopsy that shows the improvement in the vascularization and then the neurological supply as well. And this is not just limited to patients just with neuropathy. It can cover kind of a whole other area of symptoms within that neuropathy family that we didn't have treatment options for, such as chemo-induced neuropathy, as well as fibromyalgia or carpal tunnel syndrome. So we're really excited that, we have this option. You mentioned the diagnostic component that establishes medical necessity, and that's the one thing that differentiates from all the other treatment options, because we use that for the insurance coverage aspect. And then a series of treatment, high-intensity electric stimulation, along with all the other different service options that we have at our clinic, because as we both know, the neuropathy is just the starting point. These patients are suffering from a myriad of different problems, including diabetes, the medical weight loss component, the lifestyle medicine component, joint problems, altered gait, fall risk, the list goes on and on.
Yeah, so we're thinking about this new process again. As you mentioned, it covers all services because there are many reasons for that person to develop this condition. So as long as that diagnostic process can show that there's abnormality to the nerve function, we can then show to the insurance companies that, hey, there's a reason to treat, and there's ability to actually get a person better because we can implement function. And that's what we're all about, right? We're trying to improve a person's function, reduce weight, reduce the pain that limits a person's activity, start building upon their strengths, start building upon their activities, and that's what makes a person, again, more fit. Health and wellness components can kick in, and it's all based on this kind of newer innovative technology that's starting to come out in nerve generation, nerve treatment that uses stimulation. There's different devices that are out there that are being studied and researched, and here's a device now for the peripheral nerve that uses stimulation in combination with a little bit of a nerve block, so we can get a little higher intensity aspects of treatment to the nerve, and then we can start seeing those benefits. If we can dampen down some of that sensitivity, we can finally implement some of these other services that we offer, because the person is more capable of doing it, because they have less pain and they're more stable.
Right, and what we're seeing too is, a reduction of the fluid accumulation in the lower extremities, improvement objectively with the pre and post punch biopsies. And this is just a real exciting treatment option now for our patients. So what we're asking is kind of a call out for all the listening audience right now. If you know someone, or maybe yourself, that's suffering from pain from neuropathy, or maybe you aren't sure if you have neuropathy, it's really important to have the proper assessment so that we can get an accurate diagnosis. You're going to want to reach out to us so that we can get you that information. We plan on launching this treatment option in our clinic probably in the next several weeks, and what we're trying to do is kind of look ahead for those patients that are interested in this new exciting treatment option for neuropathy. We want to get you in the door first. Simply put, you're just going to enter in your contact information below. There's a ton of information about our clinic and the services that we have to offer on our website at maragalmedical.com, as well as a wealth of information on our YouTube channel. So please check out the information. The best part about it, again, is we're a full-service physical medicine clinic that incorporates medical care, physical therapy, and chiropractic treatment under one roof, and we take most insurances. So that's it for today. I hope you learned something, and I hope you're really excited about this new addition to our practice and treatment options for neuropathy. Have a great day, everyone.
Take care.